Gallstone disease is incredibly common, but that doesn't make it any less painful or confusing when it's happening to you. So we're going to break it all down. What it is, what those symptoms really feel like, and most importantly, the modern, super effective ways we treat it today.
All right, so to really understand gallstones, we first have to talk about a small but mighty organ that you probably don't think about too often, and that's your gallbladder.
So what is it exactly?
Well, think of your gallbladder as this little pouch that's tucked away right underneath your liver. Its whole job is to store a digestive fluid called bile, and your body uses that bile to help break down the fats in the food you eat. Okay, so now we know what the gallbladder does, let's get into why problems can sometimes pop up, and probably the most important part for you, what that actually feels like. So that digestive fluid we talked about, bile, is normally a perfectly balanced liquid, but sometimes things can get a little out of balance. When that happens, tiny hard crystals can start to form, and over time, those little crystals can clump together and grow into what we call gallstones.
A lot of people actually have gallstones and don't even realize it. They're just there. But when they do start to cause trouble, what are the common signs you should be on the lookout for?
Well, the biggest clue is usually a pretty specific kind of pain in your upper abdomen. You'll often feel it after you eat, especially if it was a rich or fatty meal. It's almost like your body is sending you a direct message. And sometimes that pain doesn't stay put. It can spread to your back or even up to your right shoulder. On top of that, you might feel nauseous or even actually vomit. It can be a whole mix of things.
Okay, and this is really important. There are a few signs that mean you should see a doctor right away. If you have that belly pain, but also have a fever or chills, or if you notice your skin or the whites of your eyes look a little yellow, that's your body telling you something more serious might be going on. Don't wait on those symptoms.
All right, so let's say some of this is sounding a bit familiar. The next question is, how do you find out for sure? The great news here is that getting a clear answer is usually a really simple and straightforward process.
Getting a diagnosis is really a simple three-step path. First, you just talk to your doctor and tell them what you've been feeling. Next, they'll likely send you for a simple ultrasound scan of your abdomen. And from that, you'll get a clear diagnosis. That's it.
And let's just talk about that ultrasound for a second, because I know any kind of test can sound a little scary. It's the exact same technology they use to look at babies during pregnancy. It just uses sound waves to create a picture, it's completely painless, it's totally safe, and it's incredibly accurate at showing what's going on. So once you have that diagnosis, the conversation shifts to the most important thing. How do we get you feeling better? So let's dive into what modern treatment looks like.
Okay, so when gallstones are actually causing you pain and other symptoms, the best and most recommended treatment is an operation to remove the gallbladder. And I know what you might be thinking. Wait, why remove the whole organ and not just the stones? And that's a great question. The reason is the gallbladder itself is like a little stone-making factory. If we only took out the stones, it would likely just make more. The good news is that gallbladder surgery has changed so much for the better over the years. The standard way it's done today is called keyhole or laparoscopic surgery. Just like the name sounds, it's done through a few tiny little incisions, and that means a lot less pain, very minimal scarring, and you recover so much faster. The old-fashioned open surgery with a big incision is really rare these days.
And that brings us to a question that, understandably, is on almost everyone's mind. What happens after the surgery? I mean, what's life actually like without a gallbladder?
And here's the best part. The answer is wonderfully reassuring. Your body is just amazing at adapting. See, without the gallbladder acting as a storage tank, your liver simply lets the bile flow directly into your intestine whenever you eat. Your whole digestive system just adjusts to this new normal, and it does it beautifully.
So life absolutely gets back to normal. In fact, for most people, it's way better than before because that pain is finally gone. You'll find that you can enjoy a regular diet again, your digestion sorts itself out, and you can get back to all your normal activities really, really quickly.
Okay, we've talked about a lot here, from what causes this all the way to how you get back on your feet. So, when you boil it all down, what is the single most important takeaway from all of this?
It's really simple. If you're having symptoms that sound anything like what we've talked about, the very best thing you can do is consult a surgeon and get it checked out. Getting timely treatment is the absolute key to preventing any complications. And, most importantly, it's what leads to excellent results and gets you back to feeling like yourself again.